One of the reasons I'm explaining this at such length is because I hope that patients who are desperate enough to grasp at straws won't make futile choices out of impatience. In the previous video, I explained about the widely used medication and surgical treatments for Parkinson's disease. However, even with medication and surgery, it is common for Parkinson's disease to progress gradually. When more than 60% of the cells that secrete dopamine are lost, the motor-related symptoms of Parkinson's disease begin to appear. For most people, even if they start taking medication at this point or undergo surgery because medication is no longer effective and try to supplement the dopamine deficiency, they cannot stop the gradual decrease in dopamine secreting cells over time. This is why Parkinson's disease slowly worsens. In such cases, patients may think that they have developed a tolerance to the medication or that the effects of surgery are limited, but in reality, it is not that the medication or surgery is ineffective. It is because the disease is progressing. In other words, current treatments for Parkinson's disease aim to slow down the gradual fading of the flame as much as possible, but unless there is a treatment that can add fuel or firewood to make the fire burn stronger, Parkinson's disease cannot be conquered. Therefore, most of the new treatments currently being researched aim to reduce the death of dopamine-secreting cells in the substantia nigra of the brain, or go a step further to enable the generation of more dopamine-secreting cells. In particular, clinical trials involving cell therapy, gene therapy, and stem cells are being actively conducted, especially in the United States and Europe. Today, I will focus on stem cell therapy among these and share my thoughts on it. Perhaps you have also heard stories from people around you who went to Japan or China to receive stem cell therapy for Parkinson's disease. Or more recently, it seems that there are also hospitals in Korea that frequently advertise treatments for Parkinson's disease. Based on what I know, I will explain the current global research findings, not just those from Korea, on stem cell therapy, as well as future research directions relying on facts. After watching this video, you might feel disappointed about stem cells, but I believe that this could help reduce the even greater disappointment that comes from receiving treatment at clinics that falsely claim and advertise that Parkinson's disease can be completely cured with stem cells. If we classify stem cells based on their abilities, specifically their differentiation potential, we have embryonic stem cells, reprogrammed stem cells, and what are also called induced pluripotent stem cells. Next, there are adult stem cells, and this is the general order in which they can be categorized. Explaining each of these in detail would be too extensive, so I will give only a brief overview. The adult stem cells I mentioned at the end are stem cells that can be obtained from our bodies, such as from the umbilical cord, bone marrow, fat, or skin. You can consider them to be almost free from ethical issues or the risk of cancer development. This also means they are that much safer. On the other hand, their differentiation potential, the ability to develop into new types of cells, is lower compared to embryonic or reprogrammed stem cells. This is also related to their safety in terms of cancer risk. In any case, because of this safety, adult stem cells are commonly used for anti-aging purposes. Recently, beyond just cosmetic purposes, their use has expanded to include treatments for arthritis and regenerative therapies. These are the types of stem cells most commonly encountered in clinical settings. On the other hand, embryonic stem cells are extracted from fetuses and have an extremely high capacity for differentiation. Therefore, in terms of disease treatment, they hold limitless potential. However, due to ethical issues and the fact that these cells can divide so readily, raising risks such as cancer development, it is difficult for them to be commercialized except in some limited clinical trials. Of course, there are not infrequent cases where people, feeling desperate, undergo illegal embryonic stem cell procedures in China or Southeast Asia, which is extremely reckless and dangerous. On the other hand, there are also induced pluripotent stem cells or iPS cells. In 2007, Kyoto University in Japan succeeded in creating induced pluripotent stem cells with unlimited differentiation potential by genetically reprogramming adult skin cells back to a pre-differentiated state. As a result, in 2012, this technology was awarded the Nobel Prize in Physiology or Medicine, and it is considered a core technology that could be central to future stem cell therapies. In other words, it is a technology that allows us to create stem cells with differentiation abilities similar to embryonic stem cells by genetically reprogramming a person's own somatic cells, rather than using fetal cells. Of course, in the long term, issues such as cancer development or mutations still need further verification, but the recent trend is that induced pluripotent stem cells are being widely used in clinical trials for Parkinson's disease treatment. In other words, this also means that there are considerable limitations to approaching Parkinson's disease treatment using adult stem cells. Of course, due to the risks associated with induced pluripotent stem cells, there are some researchers who are conducting clinical trials and studies on treating Parkinson's disease using adult stem cells, which are considered superior in terms of safety. Anyway, I mentioned this to let you know that in terms of differentiation potential alone, induced pluripotent stem cells are considered excellent stem cells that are reborn as embryonic stem cells. From the perspective of disease treatment that I mentioned earlier, embryonic stem cells, which have limitless potential, were already used between 1990 and the early 2000s to treat more than 300 Parkinson's disease patients who received embryonic stem cell therapy by having fetal brain cells directly transplanted into their own brains. Aren't you curious about the results? However, surprisingly, while most patients seem to experience significant improvement in their Parkinson's disease for about 1 to 2 years, after that, the majority were found to have either no effect or only limited benefits from the transplant surgery. Of course, although it was only a small number out of the 300 patients, there were cases where the progression of Parkinson's disease was halted or even improved for more than 20 years. However, to treat just one Parkinson's patient, cells from 3 fetuses are needed, and even setting aside issues such as side effects from the brain transplant surgery itself or the use of immunosuppressants, it is clear that the effectiveness is more limited than expected. Nevertheless, the fact that clinical trials using embryonic stem cells, which have the highest differentiation potential, have already been conducted and in some cases have shown long-term effects is quite significant in its own right. And even now, several countries are still pursuing clinical trials for Parkinson's disease treatment using embryonic stem cells. However, recently, there has been a growing number of treatments and clinical trials for Parkinson's disease using induced pluripotent stem cells derived from somatic cells, which are similar to embryonic stem cells in terms of differentiation potential, but are less burdened by ethical issues. In particular, in Japan, where induced pluripotent stem cell technology was first developed, many clinical studies on Parkinson's disease patients have already been conducted since around 2018. In addition, relatively active clinical trials are also being carried out in countries such as the UK, Sweden, and the United States. Unfortunately, as far as I know, there are currently no clinical trials or studies involving induced pluripotent stem cell treatments in humans being conducted domestically. I'm not completely certain, but that's what I remember. In any case, induced pluripotent stem cells possess regenerative capabilities comparable to embryonic stem cells, making them a key component of future medicine. However, since they are still only at the clinical trial stage, we cannot yet say that Parkinson's disease can be conquered with this approach. And to add one more explanation, most of the clinical trials involving embryonic stem cells or induced pluripotent stem cells are surgical treatments in which the stem cells are directly transplanted into the brain lesions. However, these days, even with this surgery, when stem cells are transplanted into the substantia nigra of the brain, which secretes dopamine, it takes a long time for the nerve cells to grow. Therefore, rather than transplanting into the substantia nigra, the surgery is often performed by directly transplanting the cells into the neural transmission pathways where the nerve cells affect the terminals. This is done in an effort to reduce the time it takes to treat Parkinson's disease, even if only by a little. In other words, when the cells are transplanted into the substantia nigra of the brain, not only does it take a long time for the cells to grow and for the surrounding nerve cells to form synaptic pathways, but there is also a possibility that these newly created neural pathways may not function properly. That is why, rather than the substantia nigra, it is preferable to target a more distal area if possible. Thank you. This means that, in order to minimize unnecessary gaps between dopamine receptors, transplantation surgery is often performed at the terminal region of the dopamine pathway. Again, this is a situation where we have to wait and see the results. We still need to see what differences exist between the traditional surgeries of the past and the more recent stem cell transplantation surgeries, but it is expected that the newer procedures may produce effects from stem cells in a shorter period of time. Nevertheless, the reality is that most scholars still have significant doubts about whether such surgeries, even if they can further aid the neural transmission process, will actually lead to a cure for Parkinson's disease. Experts point out that despite numerous clinical trials using embryonic stem cells or induced pluripotent stem cells with remarkable differentiation capabilities and even direct transplantation surgeries with stem cell therapies, Parkinson's disease still remains an incurable condition. Given that even embryonic stem cells and induced pluripotent stem cells have many limitations, there are claims that adult stem cells from bone marrow or fat can completely cure Parkinson's disease, but I will leave the judgment to you. To go even further, recently in clinical practice, it seems that the term blood stem cells has also appeared, referring to extracting stem cells not from bone marrow or fat, but by collecting venous blood and isolating stem cells from it for administration. Of course, if venous blood is properly separated, a very small amount of undifferentiated hematopoietic stem cells or mesenchymal stem cells may be found, but calling these stem cells could be a point of controversy among experts. Moreover, claiming that cells extracted from such blood can cure Parkinson's disease. Personally, I find it hard to believe, but that's just my own opinion. Of course, it is not that adult stem cells derived from bone marrow or fat are ineffective for Parkinson's disease. In fact, there are many cases abroad where adult stem cells are used in clinical trials, research, and even actual treatment processes. However, it's more accurate to think of it not as a complete cure for Parkinson's disease, but rather as something that can partially improve symptoms or slow the progression of the disease. At first, I was also quite excited when I saw cases where stem cells were harvested from fat or bone marrow and injected into a patient's vein or artery, resulting in an immediate improvement in their gait. However, as I continued to observe the progress over time, I realized that the effects do not last long, and through this experience, I came to understand that there are indeed many limitations to stem cell therapy. Nevertheless, although this is certainly not the case for everyone, one might reasonably wonder how such remarkably rapid and significant changes can occur immediately after stem cell treatment in some cases. According to numerous papers, journals, and experts, the common opinion is that this effect may not be due to the stem cells themselves, but rather to the effect of the concentrated growth factors, known as growth factors. It is also difficult to understand, even from a common sense perspective, how symptoms related to nerve function could improve immediately after stem cells are injected, because after the cells are injected, they need at least some time to settle, grow, and become part of specific body tissues. The immediate effects of stem cells are not due to the cells themselves, but rather because the growth factors injected along with the stem cells, or various growth factors secreted by the stem cells, can temporarily influence the function of neurotransmitters in Parkinson's disease. The treatment method of extracting stem cells from blood is also a way of utilizing the growth factors present in the blood, and in some patients, this can lead to a temporary improvement in the early stages. That's how such situations may occur. Although there are many limitations to adult stem cells, one hopeful aspect is that before long, even private clinics may be able to culture adult stem cells if they are equipped with a certain level of facilities and obtain approval from the Ministry of Health and Welfare or the Ministry of Food and Drug Safety. If this becomes possible, even if it does not amount to a cure for Parkinson's disease, there is hope that stem cell therapy could become more active and systematically performed more frequently, at least for the purpose of alleviating symptoms. Lastly, in addition to stem cell therapy, there is active clinical research being conducted on various small molecule drugs, cell therapies, gene therapies, and immune therapies, such as antibody treatments. As I mentioned in a previous video, more and more experts are agreeing with the view that Parkinson's disease is not simply a problem of the brain itself. In relation to this, as we see more cases where medications used to treat diabetes, cold medicines, or other antioxidants help alleviate the symptoms of Parkinson's disease, many related clinical trials are also being conducted. A representative example is exenatide, a GLP-1 receptor agonist, which is a subcutaneous injection that has become quite well known in the treatment of diabetes and obesity. Exenatide was originally developed as a treatment for diabetes, but it became widely known for its effectiveness in treating obesity as well. There have been reports that people with Parkinson's disease who were being treated for diabetes or obesity experienced improvements in their Parkinson's symptoms, so it is now being considered that exenatide may also help improve Parkinson's disease. As a result, there have recently been attempts to repurpose it as a treatment for Parkinson's disease. Of course, various clinical trials related to this are currently underway, but according to the most recent reports, some experts believe that success does not seem easy. Nevertheless, some countries are even conducting phase 3 clinical trials. Of course, we should remain hopeful, but the results so far are not very promising. Nevertheless, the increasing number of clinical trials of this kind suggests that, in addition to problems within the brain itself, systemic metabolic issues, energy problems, and immune factors are also likely to be involved in the development of Parkinson's disease. In some respects, because adult stem cells can be very helpful for cellular energy, metabolism, and immune issues, it is possible to consider that although adult stem cells do not directly secrete dopamine, they may improve energy, metabolism, and cellular metabolic functions throughout the body, which could in turn help alleviate the symptoms of Parkinson's disease. This video is a bit long and contains very specialized content, so I think many viewers may have found it boring. One of the reasons I am giving such a lengthy explanation is because for those who are desperate enough to grasp at straws, I hope that even if patients with such feelings make choices out of impatience, they do not end up making futile decisions, even if those choices cannot be called wrong. And in fact, it seems that I am seeing more and more of such patients in my clinic these days. There is no doubt that stem cells can help with degenerative neurological diseases and that they should play an even greater role in treatment in the future. However, this help should never be understood as a cure. From the patient's perspective, it is only right to decide whether to undergo treatment after hearing an honest and thorough explanation from the doctor about both the potential benefits and drawbacks of stem cell therapy, as well as the process of symptom improvement. Could this information serve as even a slightly more objective reference for making such a decision? Or could it be of even a little help? That is what I hope for. There is no such thing. Stem cells are not limited to a specific medical field. Since they aim to regenerate or restore the function of various cells, any medical specialty can approach them. I believe this is the same for all treatments. I believe that it is right for doctors who not only know fragmented information, but also understand the overall context of the diseases they treat, why these diseases occur, what treatments are available, what the outcomes are after treatment, and what the next steps should be, depending on those outcomes, to make judgments and provide treatment. And this is a personal opinion, but I really do not think it is appropriate for doctors to give their patients overly rosy hopes or a sense of certainty that stem cell treatment will bring about miraculous changes or a complete cure. It's hard to see stem cells as something that can completely cure any disease. Because, as stem cell research is still somewhat lacking, I think that doctors who too easily and confidently say that a certain disease can be completely cured or healed with stem cells, while they may be excellent doctors, should be considered with a bit more caution, at least in my personal opinion. If a doctor truly understands the full range of advantages and disadvantages of the treatment, including its potential side effects and its possible long-term outcomes, I honestly do not think it would be easy for them to talk so lightly about such rosy hopes. When it comes to stem cells, there are a variety of opinions. There are many people who view it positively, seeing the potential benefits and advancements it could bring, but on the negative side, some say it's too expensive, too risky, or that its effects are inconsistent and unpredictable. While there are certainly many pros and cons to consider, if stem cells are commercialized excessively or abused in any way, it could lead the general public to distrust stem cells, lose confidence in them, or develop misconceptions and prejudices about their use and safety. I believe this could become a significant problem for society as a whole. Such misconceptions and prejudices are not the end of the story. On a national and policy level, more investment, research, and interest in stem cells should be pursued and encouraged. However, if people become wary or skeptical, it could have a negative impact and hinder medical progress, slowing down the development of new treatments and therapies that could benefit many individuals in the future. At our hospital as well, there are quite a few patients who come in because of Parkinson's disease. Recently, there have also been people undergoing stem cell treatments, and while some patients do experience improvement in their symptoms after treatment for Parkinson's disease, there are also those who see no change at all. We can't predict exactly who will improve, but since there are some patients who do get better, especially those with movement limitations, rigidity, or autonomic nervous system symptoms associated with Parkinson's disease, we do see quite a few cases where some of these symptoms improve. I believe there are actually a lot of people who are very interested in stem cell treatment for Parkinson's disease. The most commonly used type of stem cell for Parkinson's disease, especially in the US and Europe, is adult stem cells. It's true that both in actual clinical practice and in clinical research, adult stem cells are being used most extensively. However, despite this situation, because the effectiveness of the treatment is limited, there are also some clinical trials using embryonic stem cells or induced pluripotent stem cells. What I want to talk about in today's video is that even with the use of embryonic stem cells or induced pluripotent stem cells, it is still difficult to achieve a complete cure for Parkinson's disease. Some of you may ask what the point is of using adult stem cells given this situation. While a complete cure is not possible, adult stem cells are meaningful in that they can safely and ethically be used without side effects or ethical issues to reduce side effects, slow the progression of Parkinson's disease, and improve various symptoms that appear as the disease worsens. I hope you keep in mind the value of adult stem cells in terms of symptom improvement.